Hey everyone, welcome to the most exciting part of the WHO Labor Care Guide series. That is the practicals. You've learned the theory, now it's time to roll up the sleeves. In the next few minutes, I'm going to walk you through every single section of the Labor Care Guide and I'll show you exactly how to fill it out section by section of the 7 sections that are there, just like you do in the labor ward with a pregnant woman who is in labor. This is not just the paperwork. These are very important tools that help us to give every pregnant mother respectful, timely, and life-saving care. So grab your labor care guide chart, a red and a blue pen, and let's turn knowledge into skills together. You are ready? Let's fill it out. Now we are going to fill section 1 and we are going to follow the example given by the WHO. So we'll begin by looking at the date and the time. Our patient is Mary Jane, a low-risk pregnant woman who presented with contractions and reports that she has experienced leakage of fluid from the vagina for the last hour. Her gestational age is 38 weeks. This is her fourth pregnancy. She previously had 2 births, one of a live baby and one of a stillbirth at term. She also had a miscarriage. She is taking oral iron to treat anemia. The midwife in charge asks all necessary questions and she offers Mary Jane clinical evaluation to assess the baby's well-being and labor stage. Among other parameters, the midwife found that Mary Jane has regular contractions, 3 contractions every 10 minutes, and then 5 centimeter dilatation, and there is ruptured membranes. Section 2 of the LCG aims to encourage the consistent practice of respectful maternity care during labor and childbirth through the continuous provision and monitoring of supportive care. Let's go through the example given by WHO on filling section 2 as follows. The date still remains June 7th, 2020. The time is 6 a.m. Mary Jane received a general and clinical assessment and she has been admitted to the labor ward. She is monitored by the midwife on duty, but she is not accompanied by a relative or someone from her social network. She reports feeling significant pain due to the uterine contractions and requests pain relief. She drank a fruit juice and is walking. The midwife caring for and monitoring Mary Jane during labor offered her a companion of her choice. Mary Jane wanted to be accompanied by her sister. The midwife gave directions to Mary Jane's sister as to when and how to call for assistance, given that another woman was in labor in the same room. The midwife used a divider between beds to provide more privacy. Mary Jane is with her sister and receiving instructions on relaxation techniques for pain relief. The next time of review is at 7 a.m. Mary Jane is with her sister and using relaxation techniques for pain relief. She has been drinking water when thirsty, and Mary Jane is now lying in bed in a supine position. Now let's fill section 2 as I've been talking, and you can see how it is appearing. When it comes to section 3, the section 3 is to facilitate decision making while monitoring the well-being of the baby. The well-being of the baby is monitored by regular observation of the baseline fetal heart rate and decelerations in fetal heart rate and of amniotic fluid, fetal position, molding of the fetal head and development of caput succedaneum, which is a diffuse swelling of the scalp. The date is June 7, 2020 at 6 a.m. The baby moves during monitoring and shows a heart rate of 140 beats per minute without deceleration. Vaginal examination shows 5 centimeters cervical dilatation, cephalic presentation, there is no caput or molding, and the fetal position is occiput posterior. Amniotic fluid is clear. The next review time is at 6:30, fetal heart rate of 136 beats per minute without decelerations. The next review is at 7, fetal heart rate of 132 beats per minute with variable decelerations. And then the next review is at 7:30, fetal heart rate of 140 beats per minute without decelerations. The midwife checks Mary Jane's pad and observes that the amniotic fluid is clear, given that all other clinical parameters are normal and that Mary Jane is coping well with labor. Her midwife continues checking the fetal heart rate every 30 minutes and will check the amniotic fluid during the next vaginal examination. Section 4 is to facilitate decision-making for consistent, intermittent monitoring of the woman's well-being. The woman's health and well-being are monitored on the LCG by regular observation of the pulse, blood pressure, temperature, and urine. The date is still June 7, 2020. The time is 6 a.m. Mary Jane's pulse rate is 88 beats per minute with a blood pressure of 120/80 millimeters of mercury. Her temperature is at 6.5. She passed urine at admission without proteinuria or acetone. Given that all clinical woman parameters are normal, the midwife plans to reassess the woman's observation in 4 hours unless otherwise indicated. The time of review now is 10 a.m. The Regen's pulse is 96 beats per minute with a blood pressure of 128/84 millimeters of mercury. Her temperature is at 6.9 degrees Celsius. She passed urine without proteinuria or acetone. Let's review now section 5. Section 5 aims to encourage the systematic practice of intermittent monitoring of labor progression parameters. Labor progress is recorded on the LCG by regular observation of the frequency and duration of contractions, cervical dilatation, and descent of the baby's head. Let's look at the example. The date is still June 7, 2020. The time is 6. At the time of admission, Mary Jane presented with 3 uterine contractions every 10 minutes of moderate intensity and lasting 40 seconds. Vaginal examination shows 5 centimeters cervical dilatation, cephalic presentation, fetal descent of 4 out of 5. Given that all other clinical parameters are normal and that Mary Jane is coping with the labor, the midwife assesses the number and duration of uterine contractions half-hourly. Unnecessary vaginal examinations are avoided and vaginal examinations are only performed after 4 hours. The time now is at 10 a.m. Mary Jane complains of strong pains. Her sister left the labor ward and Mary Jane is alone, lying in bed in a supine position. Her vital signs: heart rate of 96 beats per minute, blood pressure of 128/84 millimeters of mercury, and a fetal heart rate is 151 beats per minute with variable decelerations. Mary Jane has 3 strong uterine contractions in 10 minutes, lasting 50 seconds each. Fetal descent is 3 out of 5, cervical dilatation is 8 centimeters, and the fetal position is occiput transverse. Amniotic fluid shows meconium +1 out of 4. The midwife offers her a companion of her choice. Mary Jane wants to be accompanied by her sister, who has left to speak with the family in the waiting room. The midwife gives directions to Mary Jane's sister on how to support Mary Jane and comfort her by using a cool damp cloth on her face and body and by massaging her back. Time now is at 13 hours. Mary Jane maintains 3 uterine contractions in 10 minutes, lasting 50 seconds each. Fetal descent is 2 out of 5, cervical dilatation is 10 centimeters, and the fetal position is occiput anterior. Amniotic fluid shows meconium +1 out of 4, fetal heart rate of 1-2 beats per minute without decelerations. Time now it's at 13:30. Mary Jane maintains 4 uterine contractions in 10 minutes, lasting 50 seconds each. Fetal descent is 0 out of 5, fetal heart rate of 118 beats per minute with early deceleration. Childbirth takes place vaginally at 13:45 hours. Section 6 aims to facilitate consistent recording of all types of medications that were used during labor by describing whether the woman is receiving oxytocin and its dose and whether other medications or IV fluids are being administered. While Section 7 aims to facilitate continuous communication with the woman and her companion and the consistent recording of all assessment and plans agreed. So let's look at assessment. Record the overall assessment and any additional findings not previously documented but important for labor monitoring. Record the plan following assessment. For example, continuation of routine monitoring, prescription of diagnostic tests, augmentation of labor with oxytocin infusion, procedures such as artificial rupture of membranes, assisted birth with vacuum or forceps, and then lastly, cesarean section. Take into consideration that women should be involved in discussions and be allowed to make informed decisions. Each time a clinical assessment of the woman's and baby's well-being is completed, record the plan based on the shared decision. Now to our example, Mary Jane had normal progress of labor and childbirth. During labor, Mary Jane was encouraged to walk and to have a companion of her choice present. Clinical parameters remained within normal thresholds. Consequently, additional interventions were not required. That's how to complete the labor care guide. Just having gone through those examples, by now you can be able to fill it by yourself. And the next thing is to keep on practicing as you'll be working and attending to women in labor.